Hey guys, Dr. Rayleigh over at Incline Chiropractic, Colorado. Today we're continuing our discussion on sciatica. So let's begin by discussing what sciatica truly is. So sciatica starts in the low back. It's a deep, achy, sometimes sharp pain that'll go into the glute muscle, into the posterior thigh, past your knee, down the leg, and into the foot. And that can be caused by a series of things. So it can be caused by obesity. So our spine is able to carry so much weight, and when you increase that weight, it's really taxing on the spine. Today I have Hank here with me. He's going to be helping me, so let me just pull him out real fast. Okay. So this is Hank, he's my spine. So your nerves come out of the spine in these holes that are called foramen here, and when those holes become reduced, it can really cause inflammation and pain on these nerves right here. So you can imagine if you increase the weight, you're really pushing down on the spine a lot, decreasing the amount of space that has to come out of those holes. This also is something that happens whenever you have a disc protrusion or a bulging disc. So the disc will squeeze out of the back and it'll push on this nerve right here, just poking right into it, and that'll cause a shooting pain into the legs. And that's also something that can be caused by obesity. Other things is pregnancy. So you increase your weight during pregnancy, that increases the curve on the spine and really pushes down on those nerves, creating the pain into the leg. Diabetes is also caused by, it causes chronic inflammation throughout the body, so that irritates these nerves. And other things are, even our occupations. So sitting all day long, it's not really great for your spine. Also, if you have a job where you're sitting on something that maybe vibrates a lot, or if you're standing on something that vibrates a lot, it kind of squeezes those discs right out and put pressure on those nerves. So let's begin by talking about a proper sitting technique. So we're going to do a cutaway and I'll show you exactly what that looks like.
In order to create proper posture while sitting, roll your shoulders back and keep your spine straight. Keep your back against the chair and avoid a drooping or leaning posture. Distribute your weight evenly over both hips and don't lean to one side. Knees should be at a right angle and a tad higher than your hips with both feet on the floor. Move around and take breaks every hour to ensure that you're increasing activity and reducing the amount of time that you sit. Getting up and taking short breaks also helps prevent poor posture from sitting for long periods of time.
Alright, so now that we know how to properly sit, yesterday we covered exercises and stretches that are really good for the low back. Today we're going to discuss essential oils that can help reduce pain and inflammation that are in the low back, but I'd also like to talk about sleep. So when you're sleeping, I know that many of us toss and turn and we don't end up in the same position that we went to sleep in. However, in order to get to sleep, there's some different techniques that you guys can try. Let's start with, let me grab Hank again. So let's start with laying on your back. So when you lay on your back, some people this causes increased pain because it jams those joints that are back there. But if you were to put a pillow under your legs, what that effectively does is it opens up the joints. So instead of them being closed from you laying on your back, it opens them up nice and wide, and it can soothe that back pain that you're having. Also, if you're laying on your side, if you do have a true disc protrusion, it's going to be on one side or the other. So it's going to protrude out this way and cause pain down this leg, or it's going to protrude out this way and cause pain down this leg. In some very unlucky people, it does come straight out and it can affect both legs, but for the most part, it's one or the other. So if you're laying on the side that has that disc protrusion out of it, then you're going to really irritate that area because you're smashing it together. So if you lay on the opposite side, that'll open it up for you a little bit and allow for some pain relief. That's not to say that you're not going to roll over in the night and you're going to wake up from the pain. Just try and get yourself back into a position that decreases the pain. If you're laying on your stomach, depending on what size you are, that can also jam those facets together and increase the pain that you have down those legs. So your best option, even if you're just laying in bed watching TV or whatever, is to lay on your back with a pillow underneath your legs in order to open up those discs. Alright, thank you, Hank. Alright, so let's move on to essential oil. So essential oils are a really great tool for you to have at home in order to help you with different conditions that you might be experiencing. So they do help with sciatica. They can help from anything from RA symptoms, headaches and migraines, any type of back pain that you're having, shoulder pain, different things like that. They even help with digestion, just different gut things that you're having as well. So let's discuss the difference between essential oils and painkillers. So if you were to go to the doctor and you told them that you were having sciatic pain, more than likely what they're going to give you is a bottle of painkillers. And although they are very effective, they get you out of pain, they do not allow for healing to occur within the body. So a pain pill blocks that receptor, so there's a receptor going to the brain that says, ow, this hurts, make it stop, and the pain pill just blocks that reception, so you no longer feel the pain, which is amazing, right? Well, essential oils work in a similar manner. So when you put an essential oil on, it reduces the amount of pain that you're having by telling the brain, it's numb. So it causes a numbing effect, maybe some of them. So you're not feeling the pain quite as much, or it's cooling. You're using a cooling oil, so that reduces the pain that you're having as well. So it plays with the receptors in order for your brain to realize that this is not the end of the world. Yes, it may be a 10 out of 10 pain right now, but you can handle it. Okay, so why would you use essential oils then if it doesn't make it stop? Well, essential oils allow for that healing to occur in addition to reducing the amount of pain that you're feeling. So you put it on, you're 10 out of 10, then you put the oil on, maybe now you're more like a 7 out of 10 on the pain scale. So it's effectively reduced the pain, but it's still there. What the oil does is it will seep into the skin and it will bind to those cells that you have in there, those healing cells, and it'll allow for healing to occur by increasing the activity that those cells are doing. It'll also increase the blood flow to that area, so good, clean, oxygenated blood will be coming in, and all that blood that has all those cells in it that are causing inflammation and pain, they can be flushed out. So effectively, your body can heal on a cellular level if you use essential oils. Now, if you're in an immense amount of pain, maybe try both. Maybe try using a pain pill, and that gets rid of the pain, and then put some oil on as well, and then you know that you're having that healing going on in addition to it. So let's move on. Let's look at how to use essential oils. So let's start with which oils to use. So I like to use doTERRA. doTERRA is a wonderful brand of oils that's certified therapeutic grade. So if you have an oil at home, maybe you bought it at Walmart or you were given it as a gift, okay, I want you to look on your bottle and I want you to see if it has CPTG, which means it's certified pure therapeutic grade. And let's see, I don't know if you can see it right there. Certified pure therapeutic grade. So the reason why you want to use these oils is because you can use them topically. So you can put it right on the skin, which is called neat. So you just put it straight on your skin, no problem at all. Smells great, good effects. You could also ingest it. So I could drop some of that right on my tongue, no problem at all. And you can diffuse it straight into the air. So then it has the aromatic effect as well. If you're using something that is not certified pure therapeutic grade, it's more than likely a synthetic type oil, which is okay. Don't put it on your skin, definitely not, and do not ingest it. So you can diffuse it into the air. Just make sure you're reading the directions on exactly how you should be doing that, so that you don't cause any harm to your body or inflammation or anything like that. So once you've decided on a therapeutic grade oil that you really like, you're going to want to use a coupling oil. So the one that I use here at home is a virgin coconut oil. This one is solid at room temperature, unfortunately, so I kind of have to melt it before I add the oil to it and then put it on the skin. There is another coupling oil that's called, let me see if I can find it, fractionated coconut oil, which is actually a liquid at room temperature, so that makes it really easy to mix two together and put it right on the skin. You could also use extra virgin olive oil for the other Italian gals out there. However, it's not going to have the same aromatic effect because it's going to kind of smell like olives on top of whatever the scent may be that you have with it. So now that we know how to put it on, let's talk a little bit why we have to use a coupling oil. The coupling oils allow for people that have sensitive skin to use the oils topically on the skin. So if you were to try and put it on neat, some people have a reaction to it. It can turn red and hot and inflamed, and we don't want that to happen. So if you use a coupling oil, it'll reduce the amount of inflammation. I would definitely recommend trying to use it topically somewhere before you put it all over your low back or all over your knee or wherever. Just try it somewhere and make sure that your skin doesn't turn red and it stays a nice pale light color in my case. And then after that, go ahead and try and use it. If you're looking into using it neat, you can. I would not recommend children, infants, or elderly use any oil neat because their skin just can't really handle it. If you're an adult, the recommended amount is 3 to 4 drops of oil to 1 teaspoon of coupling oil. If you're going to use this on a child, you'll only want to do 1 drop of oil to 1 drop of coupling oil, so that, you know, it's a little bit more diluted for the kids. So the difference between using it neat versus using it with the oil is that it's actually stronger. It's more effective with the oil, believe it or not. However, if you're going to digest it, you're going to put it right into your mouth. You don't really want to use a coupling oil. You can just put a drop right into your mouth. On that topic, you want to make sure that the oil that you're using can be put into your mouth, because some of them, a lot of the ones that come from, like, say, trees, so pine and things like that, you don't necessarily want to put those into the system. So make sure you have a good source on which ones you can and cannot ingest. So let's go over some of them that you can use for sciatica. So some good options for anti-inflammatories would be eucalyptus or thyme or birch. All of those are anti-inflammatories, so if you put those on the skin, it'll reduce the inflammation that's happening at those joints, and that way it can create a healing effect and increase the blood flow and all that good stuff. There's antispasmodic or analgesic oils, so that'll decrease the spasm that you're having in the muscle, as well as kind of create a numbing effect. Some of those oils that are really good are peppermint, so I use peppermint quite a bit. This is the one that I use for migraines and headaches. I definitely use these on the patients that come in with migraines and headaches. You put it right on the occiput, right on the base of the skull. Hey, come here. Okay, so if Hank came in with a migraine, I would put it right here at the base of the skull, kind of where your head meets your spine, and that'll immediately reduce the headache and the pain that you're having. You can also put it right on the temples, right in this area as well, and that'll kind of reduce the headache that you're having. But back to sciatica, so other antispasmodics include sage and clove and ginger. And ginger is actually really good for rheumatoid arthritis, as is cypress, I believe. So if you have RA in the hands, you know, it can be really hot and kind of burning and aching. If you put those right over those joints, that will decrease the inflammation. Obviously, it won't make your RA go away, but it will decrease the inflammation and the pain that you're having in those joints. So the next set of oils are astringents. So astringents, what that is that's the blood flow stimulant. So that increases the blood flow circulation in order for the oils to become more effective. And good astringents are cypress and wintergreen. So you can actually make a blend of these oils. So maybe you put, let's say, eucalyptus, peppermint, and cypress all together. So, and then you put that right on the low back. So you've effectively created an anti-inflammatory, an antispasmodic, and an astringent that will help reduce the pain that you're having in the low back. So, you know, there's lots of different oils that create or that reduce the inflammation that you're having, or are an antispasmodic or an analgesic. So if you have a really good text that you can look at, and maybe you have some oils, but you don't have all the oils in the world, you know, just use the ones that you have at home, as long as you know that they will decrease the inflammation or whatever that you're having in the body. So let me just show you a little example. So I have my coupling oil here, so I'm just going to kind of warm it up with my fingers, get a little bit on. All right, so if I was having low back pain, I would get my oil out. So this one I really like. This is Deep Blue. This is a great combination of a bunch of different oils. So this one has the wintergreen in it, and it has chamomile in it, which is soothing, and this has a ton of oils: peppermint, ylang ylang, camphor, just a ton of different oils. And the whole point of Deep Blue is to allow for relaxation of the muscle. So you would take your Deep Blue, you put a drop of that on, add your oil to it, and then you put it right on the area, wherever it may be, low back, shoulder, elbow, wherever it is, and you just rub it in real nice. And another way for you to get it really deep into those muscles and into the bloodstream is to apply a hot compress. So if you have like a sock full of rice and you heat that up and you put that on there and you put some pressure on it, that really helps drive the oil straight into the muscles. Or if you have a heat pack, that works too. Just make sure that you're not going to create harm to your body. So don't make it so hot that you blister or anything like that. The skin will turn a little red. Some of them, like I said, have kind of a warming effect as it is. So Deep Blue is warming. You'll feel a kind of a warming sensation on your body when you use it. Peppermint has a cooling effect, so you'll feel kind of a cooling sensation whenever you put that one on. If you do try it on the skin and you're like, oh boy, my skin's turning red and that kind of burns, you can go ahead and just use any of these oils as an aromatic, and it essentially works the same way. So your respiratory system is really strong and very, very effective. So when you are diffusing these essential oils and you're breathing them in, it goes into the bloodstream and it'll go throughout the body to decrease inflammation. So one that I like to use a lot is frankincense. Frankincense is a great anti-inflammatory and it smells awesome. So I like to diffuse that one around the house. With everything that's going on right now with COVID, I like to use On Guard. So this is a combination of a ton of different oils put together that boost the immune system in order to, you know, keep you healthy when everyone else is sick. So I've used that a ton this year as well. But it works. It really does. I don't really know how to explain it. There's a ton of research on it. If you guys want some, I can look some up and post some things for you. But yeah, I would say these are great options for you, in addition to, you know, whenever we can go out again and you can get your chiropractic care again, you can get your massages as well. All these things will really work in order to get the low back pain decreased and the sciatic to kind of reduce while you're at home. So make sure you're getting up and you're moving around. Let me know if you are interested in any of the oils. I could order some for you. Yeah, we'll just go from there. We'll kind of do a drop-off delivery type thing. So I'll just drop it right off at your house and you don't have to worry about any person-to-person contact. But in the meantime, if you guys have any questions, you can send me a personal message or you can just leave them in the comment box below. Any other, you know, essential oil conditions that you're interested in, you can send those over to me as well. So you guys have a wonderful rest of your day and be well. Thanks.